Howdy! Thanks for learning about MS with me, Aaron Boster. Today, I am super excited to be joined by none other than the Dr. Brandon Beaber. Brandon, welcome.
Thank you for the kind introduction.
Today, we're going to partner up to answer some questions that viewers left as comments on a recent YouTube video I put out earlier this week. The topic of the video was the mRNA vaccines.
We're getting a ton of questions in our clinic about this topic, understandably, and so it makes sense for us to sort of go back and forth and have a discussion and hopefully answer some of these questions to the best of our ability. There are a lot of unknowns, but there are a lot of things that we do know.
Our first question comes from Jerusalem Warrior. As is being publicized here in Israel, the window of opportunity for us Ocrevus patients for the vaccine to be most effective is about 4 months after the last treatment and 2 months before the next treatment. Confirm? So you and I have heard this a lot about the window, and you actually made an awesome video. You published it today?
Yeah, I think yesterday, but yes, right, about this exact topic.
Fantastic video tackling this. Would you like to take a crack at answering that question?
Sure. I mean, we don't know 100%. And the video I posted yesterday was a study from Spain where they looked at people with MS taking various disease-modifying therapies, including B-cell depleters such as Ocrevus, and looking at how many of them actually develop antibodies. And so the kind of good thing about COVID-19 is most people, over 90%, do develop antibodies after getting it, at least for some period of time. That may wane, but over 90% of the general population develop antibodies. But this study showed that only 17% of people taking these medications, that's not just Ocrevus, also rituximab, presumably Kesimpta, I don't know the exact distribution. Now, that's a little bit unnerving. There are other mechanisms of immunity to antigens, viruses, other than antibodies. So the idea, I apologize, just to backtrack a little bit, the idea here is that these medications deplete the B cells, which are the cells that make antibodies. And so if you don't have any B cells, you may not be able to develop a good antibody response, which could mean, one, you could potentially get COVID a second time. And two, if you got vaccinated, it could make the vaccine less effective. And there are many studies on this. For instance, the VELOCE study, VELOCE, showed that, people getting other vaccines like the flu vaccine or the tetanus vaccine, many do make antibodies, but a little bit of a lower percentage than the general population. So yes, potentially it could make the vaccine less effective. Now, my view is most likely the longer since you previously took Ocrevus, the greater the chance you're going to develop an antibody response. But that's not really known. Dr. Barry Singer on Twitter made the point that, even if it's 6 months after Ocrevus, if your B cells are 0, maybe you're not going to develop a good antibody response. Maybe you should still get the vaccine because you could develop T cell immunity or a partial response. Personally, I'm more or less just going to recommend that my patients go ahead and get the vaccine, because partial immunity is better than no immunity. And at least in Los Angeles, we're seeing an overwhelming surge. It's an absolute disaster. Unfortunately, the vaccine is way too late, but something is better than nothing. But to me, partial immunity now is probably better than good immunity in 6 months. So I would just go ahead and get it. Now, if you're about to get Ocrevus or rituximab, it may make sense to delay it a little bit to get the vaccine. And, it takes about 2 weeks for the Pfizer vaccine to be effective, but maybe like 4 weeks to get a good antibody response. So maybe waiting a few weeks after the second dose makes sense. What are your thoughts?
A couple points of clarification that I think are relevant and in some ways are potentially encouraging. When we use a B cell killer, we're not knocking out all the B cells. So we're not knocking out the stem cells, obviously, because they grow back, and we're not knocking out the plasma cells, which self-replicate. And so it's not as if there's no opportunity for B cells to participate, but I 100% agree that it's definitely attenuated. I think the reason that Jerusalem Warrior was sharing this window of opportunity is based on the VELOCE trial. And so we were participants in that trial. And what we learned was, if you give someone Ocra and then a month later give them standard vaccines, DTaP, MMR, influenza, it works, but it works about 50%. And to your point, 50% is a lot better than no percent. I also think it's really relevant that you bring up this T-cell immunity, because we do know from Pfizer data, and I haven't looked at the Moderna data as carefully, but I assume, but with the Pfizer data, there's a robust T-cell response, which is very good. I also agree with you that at the end of the day, that perfect window, if that is the best window, is only going to be relevant for a handful of patients that happen to fall in line when they're available. So I'm telling patients the same thing. If somebody offers you the vaccine, take it. And if there's a partial response, or if there's no response, we can check antibodies. So my intention is I'll give you the vaccine whenever it comes along. And then a month before your next OKRA, I plan to check COVID antibodies to help guide us. Now, you and I don't know about the availability in the general population, but if we assume normal vaccine behavior, I assume I'll be able to give a booster if need be. Now, that's an assumption. We don't know if that's true yet, but we'll see.
You would think that eventually there will be enough to go around, even though it's very limited right now. And hopefully that video didn't scare people into not getting the vaccine, but I hope it does scare people into sort of still remaining cautious, still doing the social distancing thing and wearing masks. Until we see the overall pandemic improve, we have to do that, because the vaccine isn't 100% effective anyway.
By the way, you recently took your COVID shot. How are you doing?
I'm fine. Yeah, I posted on Twitter. I got the Pfizer mRNA vaccine yesterday, and I'm fine. I didn't have a reaction. A little sore in the arm, but nothing serious. And I have my next vaccine scheduled in 3 weeks. All my patients ask me, "Are you going to get it? Do you feel comfortable?" And after what I've seen, to be frank, I don't care if there's a 1 in 100,000 risk of Guillain-Barré syndrome or a small risk of anaphylaxis. So what? Just give me epinephrine. The carnage I've seen from COVID is horrible. And not to scare people, but I've had a patient die. I've had patients get severe pneumonia. Young people have strokes due to temporary hypercoagulable stroke state from COVID-19. I saw a patient this morning who had an embolic shower from COVID-19. I mean, I'm seeing it. And I'm not an inpatient doctor, and I'm seeing a lot of these cases.
So same here. I've had patients that have been hospitalized and ventilated. They've had pulmonary emboli. We've lost 2 patients in my clinic. It's a scourge. I have not been offered the vaccine yet. We're actually working in our clinic to figure out from the health department how we can get it. And I'm very, very hopeful that I can join you very soon.
Yeah, I mean, the only reason I got it is because I'm on call starting tomorrow, so it's kind of too late. I'm not really going to be immune, but, they gave it to me. And then they asked us to cancel some of our clinics because we're going to sort of be residents for the internal medicine teams. I don't know how valuable I'm going to be as a neurologist. Probably not very valuable, but, if they want me to make some phone calls or order labs or follow up electrolytes, I'll do whatever I can do to contribute to this.
Let us know how it goes. Let's jump into the next question written by a viewer named Ghost. So Ghost writes, I'm personally not taking it, more so because flu shots have me out for a month. So I can only imagine what this one would do. I usually always get a relapse or 2 after I get any vaccine. And so, I wanted to share this question because I don't think Ghost is by himself or herself with fear surrounding the unknown. And in particular, there's a question raised about possibly triggering an attack. Now, I would start the conversation by saying, common understanding of vaccines and MS, they don't trigger attacks like that, particularly not dead vaccines. When I look at the clinical trials data or I look at vaccine data, yellow fever is the scary one. This is one where we do see a significant uptick of relapses. I'm wondering whether Ghost is experiencing a pseudo exacerbation because raising his or her core body temperature after they're immunized. What do you think?
Yeah, I mean, the overall evidence is that the flu vaccine doesn't increase the rate of MS relapses, but, anything that causes a reaction, and these vaccines, and the COVID-19 vaccine causes a lot of reactions. A lot of people get fever and muscle aches, especially after the second dose, and that's going to tend to bring out multiple sclerosis symptoms due to UTOF's phenomenon, which is a temporary worsening of symptoms in the setting of increased body temperature, exercise. And, some people can get that even with emotional stress, mild illnesses, but we don't think that necessarily worsens the long-term illness, so it's safe to get the vaccine. It just may make you feel especially lousy, more so than someone without MS.
And I certainly want to be clear that neither of us are thinking it's cool to have a pseudo exacerbation. That's horrible. But when I weigh the risk benefit of a pseudo attack that I can help manage versus COVID, man, I would rather someone I take care of have a pseudo attack if I'm transparent.
Absolutely. Yeah. And of course, if you get COVID, you could easily have the same thing. And I've already been consulted on that before. Someone has COVID pneumonia and their MS symptoms are much worse, although usually it gets better over time.
Yep. That's a very good point. The next question comes to us from Bridget. And she writes, I've read that people with lots of allergies should not take the vaccine. I have a long list of food and medicine allergies. Should someone like me avoid it? They also say that on one hand, the vaccine causes infertility. It is a false rumor. Then others say that we don't know the long-term side effects because pregnant and attempting to become pregnant women were excluded from the trials. My daughter would be devastated if she couldn't conceive a child later in life. Thoughts? That's a pretty heavy set of questions.
Yeah, that's a tough one. I mean, in terms of the pregnancy thing, it's definitely true that breastfeeding in pregnant women were excluded from the trial, so we don't know for sure. I mean, most vaccines have been safe in pregnancy and breastfeeding and everything. The idea with infertility is there was one research scientist who speculated that some of the antigens, sort of the three-dimensional surface of the spike protein that's created by the messenger mRNA in the Pfizer vaccine and the Moderna vaccine, it kind of resembles certain placental proteins. And so they kind of speculated that in theory, this could contribute to problems. And this has not been discovered. There's no immunogenicity against the placenta in animal studies. It's just something maybe research scientists would look out for. But it's highly improbable, in my opinion, that this would cause infertility or placentitis, inflammation of the placenta. We probably would have seen it in animal studies if that were the case. So that was kind of overblown by the media, I think.
The mechanism of action of this vaccine, the injecting mRNA, should not in any way create infertility. I mean, by itself. I don't want to get so caught up in what ifs and fear that we avoid an opportunity to save a life, and not just the life of the person being vaccinated, but all the people they breathe on,
Absolutely, yeah. Now that there was a second question there with the allergic reactions.
Yeah.
And, what we've been informed is that if someone has a history of vaccine-related anaphylaxis, you may want to discuss with them the risks and benefits of getting the vaccine, because people do have reactions and anaphylaxis has been reported in rare cases. Now, usually it's treatable. You have to be observed and everything like that.
To your point, they're warning people who have anaphylaxis to vaccines, not people that can't eat peanuts or have to eat pollen.
Yeah. Yes.
And what you said earlier, I mean, if somebody had anaphylaxis to vaccines, I might still offer immunization with an EpiPen in my hand.
And you're recommended to be observed afterwards, and the nurses are people have reactions to penicillin and all kinds of medications all the time. I've given patients medications and it's caused reactions, even anaphylaxis, and they're very experienced in dealing with it. And I actually personally do have a history of food and medication allergy, but I had no hesitation in getting the vaccine. Now, if I had a history of multiple episodes of anaphylaxis with multiple vaccines, I might think twice about it.
That's fair. That's fair. Our next question comes from a viewer named Mostly Daydreaming, which is kind of a cool handle. So Mostly Daydreaming writes, "Hi, Dr. Boster. Well, hello. I love your videos. Thank you. I was diagnosed 1 year ago and I started Gilead. I am a nurse and have been already offered the vaccine. My neurologist said he thinks it's okay, but I should not take Gilead 7 days before and 6 days after each injection. I'm going to do it. I already have it scheduled. But what are your thoughts? What do you think are the concerns about stopping Gilead? What are the chances that the vaccine won't take? When you take Gilead and you've taken it for a month, you've created a downregulation of these S1P1 receptors and you've internalized your cells. If you stop for 6 days, that's not long enough to allow it to reverse. And it typically, if you look at the clinical trials data, at 3 months of being off Gilead, 86% of people are kind of back into normal lymphocyte ranges. That's 3 months, not 6 days. So for me, taking a break for a week before or in a week after isn't long enough to give you back the circulating cells. They're still going to be trapped in your lymph nodes. I don't think immunologically that it would help you mount a better immunity. What are your thoughts?
I 100% agree with that. There is evidence that people taking Gilenya, just like with Ocrevus, may have a little bit of a lower antibody response, but it still looks like a lot of people do develop antibodies to a lot of vaccines, so it's worth getting. And I just agree there's probably no benefit in stopping it. And I believe like the manufacturer recommendation of Gilenya is that if you stop for 2 weeks or more, you're supposed to redo the first dose observation because of the effect of getting a slow heart rate. So I think the doctor was trying to avoid that, but I agree with you. It likely wouldn't do anything. So I personally wouldn't recommend that, not to criticize the abilities of that patient's doctor. Everyone could have a different opinion. We really don't know, but I agree it wouldn't likely do anything.
And, here's where we make the disclaimer that we always make, that we're not giving medical advice, and that, of course, mostly daydreaming must talk to her doctor about what's right for her or him. We're just making general comments as we answer these questions. My patients on Gilenya, I'm not asking them to stop at all, and I fully intend to immunize them when we're able.
Absolutely. Yeah. And I've had some patients just stop medications just due to fear of the pandemic. And I really wouldn't recommend doing that without talking to your own doctor, because a lot of times it's unnecessary or the risks may outweigh the benefits and everything. So just, have a discussion with your doctor. They should be available to you during these difficult times.
That's exactly right. And I also feel like it's very important that we remember why we treat people with MS. It's because MS is bad for you. And I don't want to deny someone disease-modifying therapy during a pandemic and then reconnect with them disabled at the end of the pandemic. Our job is kind of tricky right now, but our goal is to keep their MS boring while we keep them safe. I don't think stopping medicine is the answer.
Yeah, everyone's situation is different, but in this situation, it's not likely to give you a better vaccine response, so it doesn't make sense to me.
Our next question comes from Candy, and she writes, I think vaccines are great and are very useful in many ways. However, I have concerns about the long-term side effects for vaccines that have not been extensively tested. 6-ish months of research creating testing is not a very long time. What are your opinions on newly released vaccines and the unknown long-term possible side effects? Is this something that you consider? How deeply do you look into this with clients who are immunocompromised, or anyone for that matter? I trust what you deliver in your videos. Thank you. Candy's question, I think, is top of mind for a lot of people. Normally, vaccines take a decade to make, and you got a vaccine just yesterday that was invented at warp speed.
Well, I respect that absolutely. And, I'm not trying to push anyone into getting it. I am recommending it to my patients, but it is a new thing. The FDA required 2 months of follow-up after these vaccines because historically most vaccines, if there were serious immune reactions like Guillain-Barré syndrome or encephalitis or transverse myelitis, they showed up within 2 months, because that's how long it takes your immune system to develop an antibody response. And then if people had like reactions to the vaccine like anaphylaxis, that happened immediately. And that is a rare side effect of this. Now, is it theoretically possible that this could have some long-term side effects that we wouldn't see for many months or years? Unlikely, but it is possible. And, we won't know that for sure. And we just kind of have to weigh the risks and benefits. What I'm seeing is so bad that we just don't have time to wait. Although one thing I would say to that specific question is by the time the vaccine becomes available to the general public, not just healthcare professionals, probably there will be 6 months of follow-up from people in the clinical trials because it started like September, and so probably by February, March or something like that. A lot of people will have 6 months of follow-up. Years of follow-up, probably the pandemic will be gone before we have that, although they are studying this in an ongoing fashion.
You pointed out eloquently that the majority of the side effects that people experience from vaccines occur in the first couple months if they see them. And so there is a rationale scientifically for that 2-month window. I also think it's relevant that we share. We didn't test this in 5 people. There were tens of thousands of Americans that were tested. And so it's not like they did a small sample. They did a normal sample size, as I understand it. The biggest thing is that the evil in front of us doesn't require statistics or theories or postulation. It is a scourge and a plague that we're now faced with. And I'm more fearful and concerned about that than a ethereal, theoretical concern. That's my 2 cents.
I absolutely agree with you.
The next question comes from Terry G. Terry writes, Hi, Dr. Boster. Well, hello, Terry. I have two questions. First, how does Pfizer not freeze if it is stored at minus 80 degrees? And how long does it take to become effective after it's injected into your body? Because we're making a rather interesting vaccine, which includes the genetic blueprint, the RNA, we have to keep it cold because RNA will dissolve. And so if you leave RNA out for several days, it'll break down. And so to keep it intact, we have to transport it super cold. Now, as I understand it, once it arrives to the site, it's thawed, and then you have a set number of days to distribute it. So you're not injecting negative 80 degree, vaccine into your body. It's room temperature.
Yeah, that's exactly right. And it's a little bit unusual that there's a slight difference between the Pfizer and Moderna vaccine because they're so similar. They're both in this sort of lipid membrane that allows it to get into the cells. And for whatever reason, the physical properties of their exact formulation are just slightly different. So the Moderna vaccine doesn't have to be stored at that cold temperature. But exactly, they thaw it before. And in fact, I saw them thawing and preparing it. So it's not going into as a block of ice. To answer the second question, you look at the curve of infections in the vaccine versus the placebo group in the Pfizer study, you can see for the first 2 weeks, they sort of track together, and then they start to separate at about 2 weeks. And so it probably has some effect at about 2 weeks, maybe not a full effect. And then at about 4 weeks, the antibody levels are high. And so about 1 week after the second dose. And so in terms of antibody response, 4 weeks, and in terms of some effect, perhaps about 2 weeks.
Excellent. And thank you for that. Our next question comes to us from Lisa, who writes, if the flu shot or anything of the sort makes you sick, will it be okay to take? People that have reacted to mono, is this okay to take? Also, is the vaccine have steroids of any type? I'm allergic to topical, injectable, etc. So what I'm really interpreting from Lisa's question is saying, hey, if I have trouble with the flu shot, am I going to have trouble with this shot? And if I have trouble with steroids, is this okay?
Well, there are no steroids in it. The good thing about this vaccine is it gives you a very strong immune response. So unlike the flu vaccine, where they have to add all kinds of adjuvants to sort of stimulate your immune system, there's very little in this vaccine other than the active ingredient. There are a few things just to kind of give it the right saltiness for your body. There's polyethylene glycol, which they think may be the cause of these anaphylactic reactions, possibly. But some people do have a higher rate of allergic reactions than others. So if you've had allergies in the past, it is possible you could react to this, but the reaction is sort of normal. That's how the vaccine works, that it stimulates your immune system. So a little bit of a reaction is normal and expected. I mean, I have a sore arm, which is presumably because there's some local inflammation. And some people, it will be a little bit worse and they'll have fever and muscle aches. But as long as it's a minor reaction, it's just your immune system working, and it could really be thought of as the mechanism of action of the vaccine and not even a true side effect. Yeah, I'm optimistic. I think eventually this is going to go away. Hopefully by summer 2021. I can't predict the future. I haven't been very good at predicting this pandemic over the last year, but I'm hopeful that eventually we will beat this thing.
I hope so too. I also am very optimistic. And a lot of my optimism surrounds getting this vaccine out to the population.
Absolutely. I mean, you could do the math, and I've actually done like a little pandemic modeling on some software I downloaded. I'm not an expert, but it turns out if a sufficient number of people are immune, then the pandemic will go away, as has occurred in several countries such as Taiwan. There's just no COVID there. And it's not because they achieved herd immunity, it's because they generated an effective replication rate less than 1. And if you have exponential growth with an exponent less than 1, it eventually goes to 0. And I honestly think one of the most harmful phrases of the pandemic was the phrase flatten the curve. I think a better phrase would have just been make COVID-19 go extinct.
Yeah.
And there are many ways to do that. One way is to be like really strict about social distancing, which we didn't really achieve. In America, I think it's going to be the vaccine that just makes enough people immune.
Let me ask you, what percentage of the population, in your estimation, needs to be vaccinated for us to be able to achieve eradicating this virus?
Well, so the idea of herd immunity is pretty complex. The idea of herd immunity is that even if there's some susceptible people in the population, if enough people are immune, the replication rate cannot be greater than 1, and hence the infection goes extinct. And the idea is, we think that the fundamental replication rate of SARS-CoV-2, the virus that causes COVID-19, is around 2.5 to 3. And what that means is if we're in big cities and we're not wearing masks and not social distancing, an average person would infect around 2 to 3 people prior to recovering and no longer being contagious or dying. And so that implies that if about 60 to 70% of people are immune, either through infection or vaccination, and hopefully more from vaccination than infection, then simply the pandemic will go away. But the reality is herd immunity is much more complex than that. Hopefully even if 40 to 50% of people with it are immune, but we're wearing masks and social distancing, that will be enough to make it go away. But human behavior is kind of complex. What's going to happen is you're going to see the rate go down, and then people are going to stop wearing masks, and it's going to go down more slowly than it should. So we can't really predict the future, but in theory, if enough people are immune, it will go away.
Let's hope. I will tell you, I was really disappointed just on Twitter, where you and I spent some time, when I put out a couple polls asking folks their vaccine willingness. It was like half. And it's my hope that over time people develop a comfort so that 50% could go closer to 75.
I think that, a lot of people, when they see millions of people getting the vaccine and not too many serious side effects, they'll feel more comfortable. My fear is, listen, we're giving this vaccine to 1 million people. You're going to see problems. You're going to see people drop dead for unrelated reasons. You're going to see people have strokes, heart attacks, Guillain-Barré syndrome. Unless there's a statistically significant increased rate compared to the general population, we really shouldn't worry too much about it. Obviously, we have to look at that. I'm not saying this vaccine isn't going to cause anything bad, because it certainly can. So far, possibly Bell's palsy, definitely low risk of anaphylaxis, but we'll keep watching. But unless it's a significant rate, I just think that the benefit so greatly outweighs the risk. And I got to say, psychologically, I feel better already. I had a strut in my step yesterday, and I'm probably not even immune yet.
I can't wait to join you. This next question is really fantastic, I think. It's from Andrea, and she writes, if I understand this correctly, it sounds like you were saying the blueprint will degrade over time. Using your example, will we have already built the bookshelf, or are we going to have to revaccinate at a later time? The way I interpret this question, I was sharing in that recent video about how mRNA vaccines work, that the mRNA itself, once it's in the cell, will eventually be degraded by the enzymes. And so I think what she's asking is, does that process limit the success of the vaccine, and will we require revaccination because of that? So the real answer is we don't know, but I think it's important to keep in mind, we're inducing your immune system to mount a response. Once we've triggered the immune system to mount a response, we don't need the stimulus anymore. That's the point. Mm-hmm. So I don't think that it limits the success of the vaccine because the messenger RNA degrades. I think that it does its job. It shows the immune system its new target. The immune system builds an arsenal against it. Then once the arsenal's there, hopefully we don't need a reminder.
Hopefully. And in theory, you develop those memory B cells that last decades. And even if you never see the antigen again, you could see it 10 years later, you still may develop a good response. Obviously, it's too early for that. We have some vaccines where you get the vaccine, you're immune essentially forever. And then there's some vaccines where you can lose immunity pretty quickly, like the flu vaccine.
And I think particularly with COVID, it's not clear yet how long people maintain immunity. That's one of my big questions. And I think, unfortunately, we're going to have to figure that out prospectively.
Yeah, we just don't know yet. It's possible people will need booster doses in the future. I don't know.
I really appreciate your time today, and I hope that the viewers on our channels enjoyed this discussion. I have. Before we jump off the line, do you mind telling everyone where they can find you so they can learn more from you?
Yeah, feel free to search my name, Brandon Beaber. It's a unique name, B-E-A, B as in boy, E-R, and I make videos about MS every Wednesday, and I also post on Twitter about multiple sclerosis research, and I'd love to interact with you.
So if you guys aren't familiar with Dr. Beaber, go check out his channel right now. It's fantastic. I look forward to your videos every week. My name's Aaron Boster, and as always, I want to thank you for learning about MS with me and with us today. I look forward to the next time I see you guys on the interwebs, whether that be on a live stream or a video, or maybe even at the Boster Center for MS. Be safe and take care.
Take care.